Hello, welcome to BQ Prime. You're watching IPO Adda, and the company in focus today is Global Health Limited, which runs the brand of hospitals under Medanta. And joining me is Dr. Naresh Trehan, Chairman and Managing Director, and
Morning.
Pankaj Sahni, who is
Good morning.
the CEO of the company. Dr. Trehan, starting with you. You started your operation from Gurugram, which is one of the largest center for you. But you have limited your operations to North and Eastern India. Why haven't you come to West and South?
So if you look at our footprint, it's Gurugram, then there is Lucknow, Patna, Ranchi, Indore, and now Noida, and then of course future plans. So we cut right across the heartland of India. So it's not just focused in Gurugram, it's across from east, cutting across, going towards the west. So there is no limitation, but we are basically into providing care where it's needed most, the best care that can be given to anybody. So that's what our movement has been, if you notice what you just asked.
So why not in Mumbai or Maharashtra? We haven't seen much of an activity in Mumbai because that's one of the biggest market for medical healthcare, right? Especially specialty healthcare.
See, as I told you already, we want to take care of the underserved areas of India with the highest end of care. So it is true that Medanta represents standards which are totally international, and it was designed to be like the Mayo, Cleveland's, Harvard of US, so that what was lacking in India was that all super specialties of the highest order, means that the people who are going to be the human capital that's going to deliver the care would be comparable to anybody in the West. They'll be on the same platform. And if you notice that in Gurgaon, we made this platform which is 1,300 beds, where 30 super specialties can function together as vertical institutes. And that's why if a patient comes to Medanta, they are sure that they will get the best treatment across all specialties, because disease very often does not occur in one form. So if you have heart disease, you also have diabetes, you can also have gastroenteritis problems, you can have surgical problems. So you have many, many things that are needed. And that's what Medanta represents.
Pankaj, you're coming out with an issue with an upper band of 336. How did you arrive at that price band?
So, as part of the process of our IPO as well as setting the price, we obviously engaged with our bankers. The bankers engaged with certain sets of investors. And over the last couple of months, we have been in dialogues with several of them, as well as some of our institutional investors, specifically the Carlyle Group, which is one of the investors who is selling their stake in the IPO. So as a collaborative process, along with our selling shareholders, along with the banks, our board of directors, taking the feedback from the investors, felt that this was the right and appropriate price, both with respect to the selling shareholders as well as with respect to the people who would be purchasing the shares in the IPO, and as well as setting up the company for future growth. So that has been the process that was undertaken.
So how do we expect to use these proceeds of the company?
So as mentioned in the RHP, a bulk of the proceeds will actually be used to pay down the loans which we have currently taken for some of our subsidiary companies. So as mentioned, we have big projects in Lucknow and Patna, which are relatively newer compared to our flagship facility in Gurgaon. And the way we operate is we take loans for this along with the equity that we've been able to generate to fund and set up these institutions. So a large part of the funding will go to repay some of these loans. And then that will set up, we already have a fairly strong balance sheet, fairly strong cash position as well. That will set up the organization for the growth that is to come in the future. So we feel fairly confident about how these assets are performing today. If you see, even in the financial year 22 and the first quarter of 23, we see both Lucknow and Patna doing very well. So this is how we feel is now the right time for us to take on this entire project of the IPO and establish the growth that is to come.
So could you help us with the breakup of how the amounts are going to be used? I just read from the RHP 375 crores is towards debt repayment. And what are we planning to do with the balance precisely?
So you're right. About 375 crores will go to repay the debt in the subsidiary companies, which is our Patna and Lucknow project, as I mentioned. The balance, we have a project that's coming up in Noida as well. So some of the funds will be utilized to set up that project. We also have growth that will come in the existing assets. So if you look at our Lucknow facility, it's approximately 500 beds now. That facility will go to about 1,000 beds. If you look at our Patna facility, it's approximately 300 beds. That facility will go to 650 beds. And we are also looking at newer opportunities, including opportunities outside the hospital space, whether it is in pharmacies, whether it is in digital play, whether it is in the diagnostic space. So what we believe is that this will provide the organization with a good cushion and a good strong balance sheet to set us up for how we see growth coming across. And then as opportunities come, we continue to evaluate them on a regular basis.
Dr. Trehan, of the 5 properties, 3 of them are mature properties, basically your Gurugram, Indore, Ranchi, which are, and Lucknow and Patna are, I think, developing properties. How much time does it take for these properties to mature and give you the same kind of cash flows as your developing as your mature properties?
So if you take the instance of the flagship Gurugram, we broke even in 15 months. Lucknow has taken off and it has actually broken even in first year of operation. Patna is following a similar trend because Patna just opened a few months ago. So in our situation, because of, you asked this question earlier about why the following areas, together we are actually servicing 400 million people plus in the heartland of India. So it's not like we are servicing small areas. So like Lucknow is 200 million population of UP, not a facility of this variety anywhere. Similarly in Patna, you'll see 130 million people. Similarly Jharkhand and Madhya Pradesh and Haryana. So you are talking about the fact that we are servicing such a large base with a high-end care at affordable prices that it takes very little, for people to know the quality difference, the value proposition, the quality of the doctors and the care that they are getting. So that's why we have had so far very good response from the public and colleagues from the medical fraternity, because they recognize that this system of providing the best on the same platform where they work together and give the patient the benefit of combined medicine is actually produces the best results you can find. And that's why what I'm saying is that our facilities have taken off much faster than we expected.
Okay.
And we don't know what the norms may be different for different people, but in our experience, it has been quite positive and proven again and again. So the whole idea was with the Gurugram facility, that was maybe such a big facility, but also others are also big. But would it be the same experience as we had? So far, it looks like we've had even a better experience in the other facilities. So it's the concept is actually quite robust and responding well.
Pankaj, your mature facilities have average revenue per operating bed of 59,000 rupees. Given the fact that the maturing developing properties are in Patna and Lucknow, which is tier 2, 3 cities, and catering to that, is it fair to say that they will have the same kind of metrics in terms of operating bed?
If you look at our performance in Lucknow facility, as Dr. Trehan mentioned, we started, in fact, right around the time the COVID pandemic started. So we started just around January 2020. And then, of course, there were challenges with COVID. But even through the entire COVID period, financial year 21, the Lucknow facility performed really well. We generated about a 15% EBITDA in that facility across the financial year 21. And as you look at financial year 22, and then look beyond that even into the first quarter of financial year 23, we see that facility performing exceptionally well. Not only on RPOP metrics, which are frankly speaking comparable to some of the best metrics across leading institutions across some of the major cities. And we see a very strong RPOP growth even in the first few months of the performance at Patna. So the performance in both Lucknow and Patna has been very strong in terms of financial, as well as Dr. Trehan mentioned, the quality and the response of patients in terms of the standard of care that we are providing. So when you look at these cities, when you look at Lucknow, when you look at Patna, I know that typically, especially if you are based in some of the other cities like Delhi or Bombay or Bangalore, there's a perception that, these cities are tier 2 or tier 3. But frankly speaking, when you go and look at the change that has come in India, when you go and, roam around Lucknow, or if you come and I invite you to visit any of our facilities, and you stand in the lobby of these facilities or you talk to patients, you will find that they don't consider themselves tier 2 anymore. And this is where really there is a very big shift fundamentally in the country. And this is what we have set out to serve. So we feel fairly confident about the RPOPs, about the financial performance in all of these assets. And so far we are seeing very, very strong trajectory on these. And by no means kind of tier 2 level performance. They are actually, sometimes better than what you're seeing in many leading institutions across the country.
I was looking to EBITDA margins. You have scaled it up to about 21% on core EBITDA. Is it sustainable, and is there enough headroom for you to go about 21%?
So, the way in which we look at our performance is that, and Dr. Trehan has this phase that, good business may not be good medicine, but good medicine can be great business. And our focus has always been both from the clinical side, from the doctors and the nurses, as well as from the administration side. Our focus has always been to make sure that you're delivering the absolute highest standard of care. Make sure that you're focused on quality. Make sure that you're focused on doing the right things. And the results will follow from that. So our approach has never been to look at targets or look at, what should be the absolute number, whether it is A or whether it is B. Our focus has been make sure you're doing the right thing, deliver the highest standard of care. And we are very lucky. We have exceptionally talented clinicians. We have an infrastructure and a technology of the highest caliber. So we operate really at that very high-end, tertiary, quaternary kind of care. And the narrative has now become that, if nothing else can happen, then, you should take the patient to Medanta, because that is where you will get the ultimate care. So many of our facilities are bigger in scale. They are destination care oriented. We do not serve only the local community where we are, but we get patients from all across the country as well as outside of the country. So our focus has always been make sure you are delivering the highest standard of care, and the financial results, which you can see in our prospectus, have followed, and we hope that will continue.
And it's sustainable.
Well, so far we have seen fairly sustainable growth across all of our assets, both the established and mature assets as well as the newer assets. We've come through fairly challenging times for the industry in terms of COVID, for the country and for the whole world. And despite some of these challenges, some of the assets have performed very well, especially the newer assets. So when you look at some of the constraints and challenges with lockdown, etc., through that entire period, which is when our Lucknow facility came on board, we did not see any dips in revenue. We saw very, very strong growth. We saw a very strong response from our patients. And this is really a testimony to the quality of care, the nature of the doctors, clinicians, etc. that we have. So we feel that this has proven over the course of the last 18 to 24 months in the case of the new assets. And of course, for the mature assets, that performance has been well established.
Dr. Trehan, can you take us through this clinic-based model which you have set up actually in and around your facility? How is it going to work? And from a growth perspective, how does it deliver to you that growth?
So first, let me rewind back to what the concept that we created. So there are three things which are very important to be able to achieve that standard which we talked about, at the highest international standard. And you need to build the facilities in a way, the infrastructure in a way, that the patients are safe in the sense of getting the medical care very quickly when they need it, even in an emergency. The environment is controlled in such a manner that the air exchanges are isolated from each other so that the infection rates are lowest you can ever produce anywhere in the world. And also then it gives you the ease of moving people to diagnostics, to the operating rooms, to the emergency room, to the ICUs in seconds, because it's a vertical movement. So you have to make that. That's how it was designed by the four Canadian architects to American and international standards of the highest order. Okay. The second thing which we require so that you can actually deliver that standard is the tools and the facilities to make those tools function in the hands of the best of doctors. So when you can accomplish these three things, the highest order of all three, that's when you produce the end result that we are talking about. So one, you have established that center in, like we said, in the midst of huge populations. Second is the point, you reach out to people, because for simpler things that they need to be in touch with you, you need to produce local clinics so that not everybody has to rush to the hospital. So there are many, many technologies now, not only clinics, but also remote consultations, like as you know, video conferencing, teleconferences. So that was already being rolled out, but COVID actually compressed the time period. So we have been able to do hundreds of video consults a day by all our physicians. So that's why it has actually transformed some of the things that we are doing and what we will do. So that now a patient, supposing he needs an operation, and so first, before they used to have to travel for our kind of facility, they'll travel 1,000, 1,500 kilometers or even overseas. They do the first connect with us. Over the video conference, we receive all the reports. We can always give them the advice that what do we think should be done. And if they need something that requires a facility like ours, then they come prepared. So it saves them one extra trip, which is expensive, and bringing families along with you and all that. So they come prepared, and it saves time for them. It makes it efficient, and it makes it more than that safer for them. Because supposing somebody has heart disease, you don't want them to be traveling up and down in trains for 1,000 kilometers, 1,500 kilometers, because then, of course, there is that risk. So this risk goes away also, because they come prepared, they come finally. So there are many, many advantages of these outreach programs that we have. And we will continue to grow them, because to facilitate the access of the patients to our main facilities also, and whatever can be done in those clinics can be done right there at that quality that we are talking about.
And so then we're getting into diagnostics as well. So there's telemedicine diagnostics. Is that going to be a support to the business, going to augment the main business, or is it also going to be a separate segment altogether?
So I think Pankaj,
the way in which we look at this entire support services as you're describing. See, at the end of the day, the entire focus has to be on ensuring that you're delivering the highest standard of care to the patients. Now, we look at the relationship that happens between a patient and a doctor or a care provider as the sacred relationship. And we build all our services to deliver to the patients around that relationship rather than trying to bypass that relationship. So as long as you keep this relationship, because it's a bond of trust, if you keep this bond at the center, then what you're trying to do is that you're trying to ensure that you can deliver these services to the patients at the most convenient and most appropriate location at the most convenient and most appropriate time. So when I look at a patient who maybe requires a blood sample to be drawn, is it really necessary for that patient to come to the hospital or to the clinic to draw the blood sample? The answer is no. So can we take the care to the patient? So what we've always discussed is that, traditionally you had this concept where you always bring the patient to the care. And now we are saying that it is time that we take the care to the patient. So whether it is home care, whether it is the use of technology, as Dr. Trehan was describing, which frankly COVID has accelerated, but we were doing much before COVID, whether it is the use of new devices. Today there are devices which are the size of your hand, where you can do hospital grade ECGs at the home. So a lot of technology improvements, a lot of mindset shift of patients as well as caregivers, a lot of the ways in which we have realized healthcare can be broken up. So the disaggregation of care. Can you actually discharge a patient home one day earlier and send somebody to their house to check in on them post-operatively? These are things which are very beneficial for the patient. And that is the philosophy behind which we are delivering these services. So we look at this as a continuum of care. Care doesn't happen only in isolated time when you're admitted in hospital. Care happens beyond that as well, and in fact, care happens even before that. So when we started out as in this industry, we always talked about managing the disease in a very acute setting like a hospital. Now then we started looking at early detection and prevention. And now we are talking about how can we actually keep you healthy. So if you look at the continuum of care all the way from health to post-operative or post-acute care, we look at this entire continuum and say what is the most appropriate, best way to deliver that care for the safety, quality and convenience of the patient. And that is why these services are being rolled out.
Is it going to be rolled out to all the in-house patients who are there, or are you going to open it up for general public? And if you're going to open it up to general public, are you going to expand your diagnostic vertical in a major way? Because that's vertical is also getting very hyper competitive as we speak.
Yeah. So obviously, because we have a certain community of patients that are in touch with us, whether they have been treated in the past or whether they are connected into our clinicians. So obviously, these services are being provided to those patients, that community. And then, as that community expands in terms of their family members, so there is certain geographic benefits to being associated in the states or in the cities where we currently operate facilities. So that will be our first foray in terms of providing these services, to focus in on the areas where we currently operate, because that's where the maximum patients are. But we do get patients from all across the country as well. So we will be looking at opportunities to ensure that we are able to service these patients wherever they may be. Now, how this scales up, I guess time will tell. We are very clear about the fact that our goal in this is to ensure that we are delivering this service at the same quality standards that we have come to be known for in Medanta. So our goal will be to ensure you deliver high quality, high integrity, high value based services across all of this. If this takes us beyond the cities or the states where we currently have facilities, that's absolutely fine. But wherever we go, we will ensure that we continue to maintain the standards and quality that Medanta has come to be known for.
Dr. Trehan, many of your peers and competitors have gone in for the O&M model, asset-light model basically. What is your view in it, and do you also look to aggressively pursue that kind of model?
No, there is no fixed model. I mean, what other people do is in their wisdom, whatever they like to do. Our driving force, is coming out between what Pankaj and I have been saying, is that the first thing is the quality, the integrity, and the pricing that we give to the public who needs care 24/7. So the point is, wherever there is need to provide a service, in whichever model it may be, keeping these three things in mind that I just mentioned about the quality and all that, we will move in many directions. So there is no limitation of thought, but there is a principle behind the thought. And like always, we don't want to make medicine transactional. Medicine has a holy bond between the patient, the doctor, and the institution from which you are actually serving. So as long as other facilities may be available, O&M, brownfields, whatever, we are open to it. But these three principles must apply, because that's where our actual strength and our mission is. So to provide at the underserved. Aim being, what's the aim of India basically? India is underserved in health indices and also facilities. And it has taken a very high priority in the government's scheme of things also, which is a very good thing. And different models will emerge, and we'll be there everywhere, wherever it is, to serve the people. Our whole mission is that, like I said, Pankaj said it, that if you can deliver satisfactorily highest end of care to people at an affordable cost, that mission will also give you a financial return also. So it's not that you need to chase or transactionalize a service. So we don't have any quotas. We don't, our people are free to do their work at the highest quality. And we do insist that they keep moving to a higher and higher standards, and we all grow together. That's the beauty of it. If you have all the leaders on the same platform, we actually egg each other along, because there is always, science moves with the speed of lightning. So a lot of priority in our way of thinking, our way of establishing institutions is that we must be ahead as the people need whatever is required at the cutting edge. So that's why we are more concentrated on looking at where the need is, where we can provide that facility at the standard that we want, and if it is not existing, we'll make a greenfield. If there is a facility available where we can do an O&M, but it lends itself to the highest standard, yes, we will do it. So it's not that we have a fixed or closed mind, but we have a principle-driven mind.
Pankaj, you have enough dry powder for that kind of growth? Because you just limited yourself to 500 crores in fresh equity.
Yeah, if you look at our balance sheet, as I mentioned, our position currently is fairly strong. Even before the IPO, we are already sitting on about 500 crores plus of cash in the balance sheet. Our debt position is fairly strong. Our debt coverage as well as our interest coverage ratios are all very, very healthy at leading levels. So with the primary capital that is coming in of about 500 crores in the IPO, we feel that Medanta Global Health is very well established to actually capitalize on this. And also keep in mind that these things happen over a period of time. Our financial performance in the last year from an EBITDA point of view has been also very strong. So we feel that this will continue to add to the balance sheet, continue to add to our kitty. And we will work these models in the most appropriate and intelligent manner to scale them up. Like Dr. Trehan said, there is no model which is closed to discussion. Each model has to be studied in the right manner, making sure that we are able to achieve the objectives of high quality care, right kind of ethics, right kind of institution that we need, in the right kind of locations to be able to make a difference to those communities. So we feel fairly happy with the financial position that we have, including the IPO.
So in other words, basically, look at Medanta not as just a hospital, but a standard of care. And wherever Medanta is needed and that standard of care we would like to provide, we will do it. So that's the driving force.
Just one question on the numbers. The current ROCE stands at around 16% versus the peers, which is in the range of 25 to 32. We are also infusing more capital. So, how are we trying to improve these ratios? Are we going to see any improvement soon?
So if you look at the history of our organization, and if you look at kind of what we've built, if you take our mature facilities like our Gurgaon facility actually, from the financial performance of a single facility, we have been able to actually generate almost 1,500, 1,600 additional beds. So the equity and the capital base which came to build out your facility in Lucknow and to build out your facility in Patna has actually come from the financial performance of your Gurgaon facility. So given the stage which we are in right now, a lot of this capital has been deployed, and the way in which we build out our facilities, if you go and visit our Lucknow or Patna facility, you'll see the complete building is there. So, and then now we just add in the interior, so we can add up 50, 100 beds as and when they are required. So it allows for us to do scaling that very fast. So bulk of the capex has actually already gone into the ground. So a lot of this investment has actually gone in now. The time to capitalize on this operating leverage, the time for this growth will be there. And if you actually look at the return on capital, which has been generated from our mature assets, it is significantly higher than many of the peers, almost to the tune of about 30%. But that return has been used to build out 1,000 beds in Lucknow, build out 650 beds in Patna. And now that we put this capex into the ground, you have a kind of a good runway for managing the operating leverage that is to come. And this also allows us to ensure that you build out a very high quality asset. Now we've got lots of high quality doctors, high quality technology in there. So we actually see this as a very, very stable and strong journey of growth as we are coming in. And early stages are quite supportive of that if you look at what Lucknow and Patna have been able to do in the last couple of years.
Dr. Trehan, I wanted to end with your thoughts on the TPA model which has come in, right? If you look at your operation, 60% comes from cash, 25% from TPA, and maybe 9 to 10% from central government schemes which are there. As we go ahead and as medical insurance also gathers pace and brings more people into the thing, it is going to become a larger part of your revenue base. And that will bring in the issue of working capital, because cash is currently used for working capital, but TPA takes 30 days or 60 days as the agreement between hospital chains and insurance companies are. How do you see this model evolving?
So it is true that as more and more people come into the insurance loop, TPAs are used typically to service the patient and the intermediary between the insurance companies and the service provided by them. That will increase, but it's a cycle. So when you say 30 days for payment or whatever your agreement is with the TPAs or the insurance companies, it's just it washes itself regularly. So it's not that it creates any shortage of payments. It's just is a cycle. So for people in our situation where you're not starting off from zero, because we already have a robust moving system, that for us it will not make too much difference. But it is welcome that more and more people should get insured, because if you look around the world, there is the only safety net that is provided to individuals, because nobody prepares for an illness which may cost. If you're going to get the best of treatment with the latest of drugs and technology and all that, it will cost. Although that cost in India will be 1/5 to 1/10 of what is costing other places in other, say, Europe or US. But in spite of that, Indians don't have that much reserves for them to deal with maladies like this. So insurance cover is definitely very important for each individual. It should grow. TPAs will be the intermediaries, which is nothing wrong with that. Yes, you're saying that the payment cycle may increase by 15 to 30 days. That's fine. But you can also see what it will do. We are just starting. Healthcare in India is just starting, whether it be private facilities or government facilities. We are half of what we should be. And don't forget, we are adding 25 million people to our population every year. So when you talk about 5 years, you're talking about in excess of 1 billion people already there to be serviced. So there is a lot of catch-up we need to do. The story is just starting. And I think that there is no question that we need to provide all the safety nets that we can find. So whether it's a government scheme, and as you know, the government has taken a very bold step with Ayushman. And then there are CGHS schemes and all that. And also we feel that the employers should be responsible for providing insurance to all their employees. And it's happening in some of the better companies, but not across the board. So if these things happen, one, it will provide huge relief to the population in their time of need, because it's very disturbing to see if somebody is sick and can't access healthcare. So that's the other responsibility which we carry. So I think
Pankaj,
over a period of
do you
time,
think that brings in some kind of challenge in cash management?
So look, if you look at our debtor days, for example, our recovery periods are actually quite strong. We are able to churn our working capital in a very meaningful way. So I don't see this as being a big challenge for us at all. In fact, when you look at like what Dr. Trehan was saying, as insurance expands, you will find ability of more and more people to be able to access the kind of quality and standards of care that we provide. So all in all, we feel that this is a very positive movement. You will have a greater sense of comfort in terms of patients being able to get the safety net. You will find a greater ability of these patients to access the highest quality of care. And we are working very closely with the insurance companies to see what is the best way to make this entire experience better for the patients, more efficient. So we have working groups across the industry with the payers and the providers to do all kinds of activities like trying to make the discharge process smoother, trying to facilitate them to be able to get their claims settled faster, etc. So we don't see any big concern on this front at all. Like I mentioned already, we have a fairly strong balance sheet, and this cycle will continue. So as long as this cycle continues to move, as long as this cycle continues to flow through, we think that these are positive movements.
So no, one more thing if I can add here, is that when the insurance and accessibility expands, no matter how, Medanta's planning of capacity will only be better served for the people and for the organization. So Medanta is geared for higher volumes when they come, so there is no stress as far as we are concerned that patients come from whichever insurance background they come from, they could be serviced very easily.
Gentlemen, I'm running out of time. Thank you very much. The Global Health IPO opens next week. Price between 319 to 336, valued at 9,000 crores at the upper end of the price band. Thank you very much for joining us on BT Prime.
Thank you.
Most welcome.